Hello, everyone, and welcome to Afya Nutrition Hub, your space for simple, practical nutrition guidance for your daily life. My name is Viola Chepkorir, a nutritionist. Please like, share, and subscribe so that we can learn together. So, today I have a very interesting topic that is preconception nutrition care. I would like us to understand what it is and what is the importance of having preconception nutrition care before conception. So, preconception nutrition care, when we talk about preconception nutrition care, it's actually the process of having nutrition assessment, counseling, and providing adequate nutrition interventions to all women of reproductive age and also to men. That is before conception, and this is actually to optimize their nutritional status, improve reproductive health, and also promote healthy pregnancy as well as birth outcomes, because we actually all need to have a healthy baby. So, having a healthy baby begins way before conception. So, you must be wondering, so do men also need to have good nutrition status before conception? Yes, they actually do, because a father's nutrition status and overall health can actually influence fertility, sperm quality, conception, and even the health status of the fetus. So, good nutrition status for men is very, very important because it can help increase the chances of having a healthy pregnancy as well as a healthy baby. So, let's talk about the importance of having preconception nutrition care. So one, it actually helps in improving maternal nutrition status, and this ensures that all women enter into pregnancy with adequate nutrition stores. And this actually helps in preventing a mother from being underweight or overweight or obesity before conception, because we all understand that this can have a negative nutrition implications to the pregnancy outcomes. So we want to ensure that before a woman enters into pregnancy, her nutrition reserves or stores are catered for so that they can have a small pregnancy and have a healthy baby. Secondly, it's also promote healthy fetal growth and development. So adequate nutrition here is before conception will help in supporting proper embryonic and fetal development, and this actually reduces the risk of birth defects, especially the neural tube defects, through having adequate folic intake actually before conception. We'll talk about that and know what amount of folic acid do women need before conception. Thirdly, it also helps in preventing micronutrient deficiencies, because we've said that most women really enter into pregnancy uh, with inadequate nutrient stores. And when we talk about micronutrient deficiencies, most women can have what we call hidden hunger. This is micronutrient deficiency because one might have adequate calories, but again does not have or does not get enough essential vitamins and minerals that are required for good health and normal body functions. So it's actually called hidden hunger because the signs of macronutrient deficiencies are often not immediately seen or noticed, but however, they can have or they can cause serious and long term health consequences for both the mother and the baby. So that's why it's good to have or to replenish your nutrition reserves before conceiving. Thirdly, it's also number four, it helps in reducing pregnancy complications. So before that, we'll talk again about some of the micronutrient deficiencies or the micronutrients that a woman need to take before conception in order to ensure that her pregnancy or journey is well catered for. So some of the pregnancy complications that can be prevented or managed well includes maternal anemia, because again some women can enter into pregnancy with anemia or low hemoglobin levels, and that also have a negative impacts. Again, some of the conditions can include gestational diabetes, hypertension disorders, preterm births, and low birth weights. All this can be prevented long way before conception period. Again, it also helps in supporting fertility because here during this period we encourage mothers to take or to have healthy eating habits, have moderate physical exercises, as well as avoid drugs or substances that can negatively impact on the growing fetus. Again, it also helps in breaking the cycle of malnutrition because this is supporting optimal cognitive development and immunity in children. So, this reduces the risk of chronic diseases later in life for both the mother and the baby. So, let's now talk about the micronutrients that are required during preconception period to ensure that we have a healthy pregnancy and a healthy baby at the end. So one of the most important micronutrients during this period is actually folic acid. So folic acid helps in preventing neural tube defects and it also supports cell growth. So a woman requires around 400 micrograms or zero point 0.4 milligrams of folic acid per day during preconception period. And so you are required to start taking this folic acid 1 month before conception and continue through the first pregnancy, the first trimester. So folic acid significantly reduces the risk of serious birth defects of the brain and also the spinal cords. And here we will be able to prevent conditions such as the spina bifida and anencephaly. Why? Because neural tube develops very early during pregnancy. Actually, 1 month before even a woman realizes that she's pregnant, the neural tube would have closed. And folic acid is required during this period to help in closing that neural tube. So some of the food sources for this include dark green leafy vegetables, liver, we have beans, lentils, citrus fruits, fortified cereals, among others. We also have iron, number two. Iron, a woman requires around 18 milligrams per day of iron, and this will help in preventing anemia and support oxygen transport because we don't want a woman to enter into pregnancy with low hemoglobin levels because it can actually result into miscarriage and negative implications can come as a result of low hemoglobin levels. Thirdly, we also have calcium, and this helps in building strong bones and teeth, and also it supports muscles as well as nerve function. So a woman requires around 1,000 milligrams per day of calcium. Number four, we have iodine, and iodine is also very important because it supports thyroid function and brain development as well as nervous system development. We all understand that thyroid hormone regulates growth, metabolism, and brain development. So adequate iron is required before conception to help in ensuring a healthy pregnancy as well as optimal fetal development because severe iron deficiency can lead actually to impaired mental and physical development in children. Number five, we also require vitamin D. Vitamin D ensures calcium absorption and also bone health as well as immunity. So, adequate calcium cannot be absorbed if we don't have vitamin D, and we require around 600 international units per day or 15 micrograms of vitamin D per day. Another micronutrient is zinc, and zinc is actually important because it supports fertility, immunity, as well as cell growth. So you require around 8 milligrams per day of zinc. And then another one is vitamin B12. B12 is essential for red blood cell formation as well as nervous system function as well as DNA synthesis. So we require around 2.4 micrograms per day of vitamin B12. And then we also require omega 3 fatty acids And this is actually important because it supports brain development as well as eye development of the fetus, as well as supports fertility. So a woman requires around 250 to 500 milligrams per day of omega-3 fatty acids. So next time, we'll talk about the importance of preconception care to men before conception. So please share, subscribe, and like so that we can get to learn and advocate for good health before conception period. Thank you so much.